DNN for Hospital Information Management System, HIMS. AI Model, Risk Level versus Age Group. Pradeep K. Suri, author, researcher, consultant, and AI/ML architect. Bar chart explanation of the output chart from HIMS DNN. The chart you provided is a grouped bar chart generated using Plotly with a dark background, and it represents risk level versus age group in a hospital setting based on data processed by a deep neural network, DNN, system within the Hospital Information Management System, HIMS. Magnifying glass tilted right title summary. DNN for Hospital Information Management System, HIMS. Risk level versus age group. Pradeep K. Suri, author, researcher, consultant, and AI/ML architect. This title clearly identifies the use of deep learning, DNN, in healthcare analytics. The application in risk assessment is based on patient age. The expertise and authorship of Pradeep K. Suri. Brain what the chart shows. Age group low risk, medium risk, high risk. 0 to 18 820. 19 to 30 15 51. 31 to 45 12 10 3. 46 to 65 14 6. 61 plus 2 8 10. Chart increasing interpretation by age group. Small blue diamond 0 to 18 years. Majority are low risk, green bar. Very few in medium risk. No high risk patients in this group, typically strong immunity and fewer chronic conditions. Small blue diamond 19 to 30 years. Still mostly low risk, but a slight increase in medium and high risk. Might represent young adults with lifestyle-related risk factors starting to appear. Small blue diamond 31 to 45 years. Risk becomes more distributed. Noticeable rise in medium and high risk patients. This group may have stress, metabolic disorders, and early onset chronic illnesses. Small blue diamond 46 to 60 years. Medium risk peaks highest across all age groups. Significant rise in high risk patients. Represents a transition into age-related diseases, example diabetes, heart disease. Small blue diamond 61 plus years. High risk dominates, 10 patients. Aging effects and chronic diseases make this group the most vulnerable. Low number of low-risk individuals, which aligns with expected health deterioration. Direct hit business or clinical use. This type of analysis enables prioritized patient care, more attention to high-risk elders. Resource allocation, ICUs, specialists, monitoring systems. Predictive care models use AI to intervene early. Public health planning based on population age and risk. AI brain conclusion. This chart showcases the AI-driven insight generated by a DNN in HIMS, enabling healthcare professionals to visualize and act on patient risk stratification by age. The model can be trained further to predict risk dynamically using symptoms, vitals, medical history, and other parameters. Expand the analysis and chart to include gender-wise and disease-specific risk levels. Here's how we can approach it. Counterclockwise arrows button. Updated scope of the HIMS DNN output. We'll add 2 layers to the current risk vs age group analysis. 1 gender-wise breakdown. 2 disease-wise risk stratification. 1 gender-wise risk versus age group. This will show how risk levels vary for males and females across different age groups. Bar chart sample table, gender-wise risk level versus age group. Age group: gender low risk, medium risk, high risk. 0 to 18 male 510. 0 to 18 female 310. 19 to 30 male 1030. 19 to 30 female 521. 61 plus male 136. 61 plus female 154. Chart increasing graph. Grouped or stacked bars by gender for each age group. Colors: green, low, yellow, medium, red, high. 2 bars per age group, male/female. 2 disease-specific risk analysis. This shows how different diseases contribute to risk levels across age groups or in general. Bar chart sample table, disease-wise risk classification. Disease: low risk, medium risk, high risk. Diabetes 3 7 10. Hypertension 5 10 6. Asthma 463. Heart disease 249. COVID-19 136. Chart increasing graph. Bar chart or heat map. Each disease on the x-axis, stacked by risk level. Help visualize which conditions lead to the highest hospital risk. Thank you.